Hello, everyone. Welcome to today's discussion on a very important topic, autism in our Ghanaian community. My name is Alice, and I am a mental health counselor dedicated to promoting mental health awareness and breaking down mental health misconceptions in our Ghanaian community. Through education and awareness, we can reduce the stigma around mental health and be better equipped to help each other out. Recently, Zion Fellis did an interview with NDA Nana Donko Arthur. Nana Donko Arthur shared her experience of being a mother to an autistic son in our Ghanaian community. In that interview, she was able to share her own mistakes that she made along the way, how she overcame those mistakes, and how she also takes care of herself as a mother who has an autistic child. Autism or autism spectrum disorder is a neurodevelopmental disorder that affects how a person communicates, behaves, and interact with the world. Whenever you hear a word that starts with neuro, it means it has to do with the brain. So autism as a neurodevelopmental disorder means that it is a disorder that affects brain development. Neuroscience, it means brain science. When you hear neuropsychology, it means brain psychology. Neurosurgeon, it means brain surgery. So whenever you hear the word neuro, you have to know that it has to do with the brain. Unfortunately, in our Ghanaian community, there is a lot of misconceptions. There is a lot of myth when it comes to autism. Let's watch Nana Donko Arthur talk about her experience, and we will be back.
I hear say in advanced world like America, Europe, Asia, so when you're they're able to detect all these issues.
It's a lie. Autism, no. Autism is a behavior. And yet to say Down syndrome. What you say, and now be a hole in heart. Autism a behavior. Autism ye you know. In your mess sanka we no one ye. And Zion ka we say we need combo. But won't me din combo. Me friend was say we jeso. Won't me jeso. Me kasa won't me show me nim. E was sanka akọ toilet na akọ egu ho. E no na ye ma autism ti no. Obi obekasa asam na che obi oboa.
Autism is a spectrum. When we talk about a spectrum, it means that it varies. There are people who may be at the lower end of the spectrum, and there are people who may be at the higher end of the spectrum. Some people's cases may be mild, some people's cases may be moderate, some people's cases may be severe. Autism spectrum disorder is different from birth defect, is different from Down syndrome. Some birth defects can be detected during pregnancy. However, autism cannot be detected during pregnancy at this time. In our Ghanaian community, there are many myths around autism spectrum disorder, and it creates a stigma around autism that also keeps people from getting help, and it also allows people to take advantage of family members who are seeking help. Let's address some of these stigmas. Number one, autism is caused by spiritual curse or witchcraft attack. This is a common misconception in our part of the world. Autism is not a curse. Autism is not a spiritual curse. Autism is a neurodevelopmental disorder. Blaming it on spiritual factors can delay the support a child gets. Remember, when it comes to autism, early intervention, early detection is very important. So if we blame it on spirituality or curses, it hinders people from seeking help. And as such, people are not going to get the help that they need.
We started to say, suffer, pray for me in any idea.
And did that work?
I'll be some question. They just took advantage of me.
Myth number 2 is autism affects only children. Autism is a lifelong condition. Symptoms are often noticed during childhood. People with autism grow to become adults. Often their challenges grow with them. The second thing is that if we have the perception that autism only affects children, it negates the experiences of autistic adults who are living with autism. They may feel ostracized by society and they may not get the help that they need. So autism is a lifelong condition, and as such, interventions should also go with a person's age and where they are in life. Children with autism need support, and adults with autism need support as well. Third myth is autistic people cannot succeed in life. Absolutely false. There are many, many, many autistic individuals who are thriving in life. The most important thing here is people getting the support that they need, people getting the intervention that they need. Individuals with autism can go into the workplace to work. They can have healthy relationships. They can be parents. They can do so many things as long as they get the support that they need. The fourth thing is autism is a result of bad parenting. In our Ghanaian community, there is this perception that parents who indulge their children, parents who pamper their children, parents giving their children whatever they need, and as a result, the children then become autistic. This is very false. Autism is not a parental fault. Autism is not a parenting failure. Autism is not a flaw in parenting. Autism is not the result of parents. We have to stop putting the blame on parents. This is biology. This is science. This is our body sometimes doing different things. And it's not the fault of parents. You cannot parent a child out of autism.
No, and one bed diagnose,
Okay.
And only young Ghana for my accept it, me couldn't accept it because ye jidi so wamobwa. Because I mean, not the background to or trauma me. Until me boy shame Google na me whom kwala video na de no na me say no we couldn't say. Tina Joe Quidgement to Joe Bayer no na me de churn say almost your real crew say yari no was ana me can say yari and Joe ni bufuye. David, but I feel this within short time and then we started to say software.
It is very important to recognize the signs and to seek help. Remember, early detection is key. Number one, it is very important that parents take their children to all their appointments. That way you have a collaborative relationship with your pediatrician, with your doctor. If anything happens, they would notice. Number two, be honest with your healthcare provider's parents. If there is something happening to your child, if your child isn't meeting a certain milestones, we as Ghanaians, we like to cover things up. Please, 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 please be honest and be transparent with your healthcare provider. Number three, if you notice any difficulty social interaction, such as your child picking up on cues, sometimes your child talking, sometimes your child reading body language, sometimes your child interacting with their peers, it could be time for you to take them to get assessed. Repetitive behavior is one of the signs of autism as well. So head banging, head rocking, sometimes a child going back and forth, sometimes a child doing the same thing over and over again. That could be a sign of autism. Remember, as I am sharing these tips, I don't want you to use it to diagnose your child because assessment is a holistic thing that is done. So if you notice any of these signs, it is just to prompt you for you to take your child to get fully and thoroughly assessed. Another sign could be delayed speech and delayed communication skills, sensory issues, sensitivity to touch, sensitivity to textures, food textures, clothing textures could be a sign of autism. Each individual's experience and signs is going to vary. So again, it is very important that you don't go off the things that I have mentioned to say that, oh, your child is autistic. You have to take them to the doctor for them to get thoroughly assessed and for them to get full diagnosis. Now let's talk about treatment and support. Autism isn't something that can be cured. That is why there is a whole movement that is redefining what autism is, relabeling it what it is, and saying that it is neurodivergence. That means a different way of the brain functioning, a different way of the brain seeing the world, a different way of the brain interacting with the world. Even though autism isn't cured and the goal shouldn't be to cure your child of autism, there are certain things that you can do to support your child, such as therapy in general, to help your child to build the skills that they need. Speech and occupational therapy can also help your child to develop some of the skills that they haven't developed yet. Some children may need special education. This is why it is very important that you get that early detection and early assessment. Because when you do that, then the school can recognize that your child need extra support. And if the school that your child is in, if the school cannot provide them with the support that they need, then you can be recommended to another school that can provide that kind of support for your child. So it is very important that you take the necessary precautions early. When you get the assessment and you are given like a thorough treatment plan, it is also very important to follow the treatment plan. Parents, children need community support. That is part of the intervention. Part of what we can do as Ghanaians is to be welcoming and to be accepting. Nana Donko Arthur shared her experience of how people in our community use her children against her, and that is very sad. That doesn't show empathy from us as a community. What that communicates to other people is that they cannot come out in the open and share their experiences of living with an autistic child, being a parent of an autistic child. It put people further into isolation, and that is not good. So we as a community, we have to be inclusive. We have to be welcoming. We have to be tolerant. We have to be empathetic. We have to be compassionate. We have to educate ourselves so that we can support every member of the community. And this also goes to our government, right? Our government and our healthcare systems need to upgrade. Our schools need to upgrade in order to support children with autism, in order to support individuals with autism. We talk about how it takes a village to raise a child. And this is what I want us to carry forward in all our things. It is time then to extend that spirit of it takes a village to raise a child to autistic individuals, to parents raising autistic children, to autistic children. Let us support them in that way. By our schools, by us as a community, by holding those parents, by being kind to them, by telling them that it's okay. Even our churches need to do better in welcoming such parents into our churches. It is very important. If you are a parent or if you are an individual and you suspect and you identify or relate to any of those signs that I talk about, it is very important that you seek a mental health professional to do a thorough assessment. Autism is not a curse, and it's not something that should be feared. Autism is simply a different way of seeing the world, a different way of understanding the world, a different way of behavior, a different way of interacting with the world. It is not the end of the world for a child or for a parent. If we support parents with autistic children, we create a community, a society where we welcome everybody, where we welcome everybody's talent, everybody's capacity, everybody's capability, where we welcome a different way of understanding the brain, a different way of relating to each other. We also welcome the beauty of life, and we appreciate and acknowledge the diversity in who we are as people. Thank you for watching, and remember that through education and awareness, we can reduce the stigma about mental health in our Ghanaian community. Please subscribe if you haven't yet. If you have any questions, put it in the comment section. Let's keep the conversation going in the comment section, and I will see you in my next video. Bye.